My honor to welcome Kathy Greenlee to you today. Kathy is Assistant Secretary for Aging at the U.S. Department of Health and Human Services. And we're delighted that she's with us. She joins us today representing Michelle Obama, who couldn't be with us. So, Kathy, we're grateful you're here. Kathy might be relatively new to her role in the Obama administration, but she's an old friend of Aging Services. Prior to her appointment, Ms. Greenlee served as Kansas Secretary for Aging. Somebody from Kansas out there? She also served as that state's long-term care ombudsman, and we are honored when Ms. Greenlee keynoted our long-term care solutions forum in Kansas last March. And we are honored that she's joining us to share her vision of providing services that people need when they need them in a place that they call home. Please help me welcome Assistant Secretary for Aging, Kathy Greenlee. A lot of supporters out there.
I do. Thank you very much. Thank you all. I heard you had sunflowers, group. Do you have sunflowers? Thank you, thank you. Thanks to Larry and thanks to Tom for his introduction. And congratulations on a fabulous turnout. What a huge venue. So I hope you have a good week. I know this is the beginning of your week. Someone, I don't remember if it was Larry or Tom, was talking about the Idea House. I had the opportunity to visit your Idea House before I came up here this afternoon, so I would encourage you, if you just got to the conference, to take a look at the Idea House. It's very innovative in the type of technology that we're advancing that might be able to help seniors stay at home and stay active. I've had the opportunity to see other such technology kind of forums or showcases. There were some things in this Idea House that were new, some things that I had seen before. So I'm very much excited about the technology and what we might be able to do to help seniors. Now, I've been in Washington for 4 months, and one of the things that I've learned in Washington is that I can go to anybody and say, I have a good idea, and they'll say, can you prove it works? So with regard to technology, I'm very excited about the possibility, but I would also ask those of you who do this work to help us demonstrate good outcomes so that we, as your partners in the government, can demonstrate what's effective and what works for seniors, because I think there's much promise in being able to help seniors stay at home, and I'm very, very excited to be partnering with you on that. As Tom said, I've been honored to join you today on behalf of the First Lady. It's wonderful to come here to Michelle Obama's hometown. I had a chance to meet the First Lady recently. She came, as you may have read, she's made her rounds to all of the different departments within the federal government. She came to HHS, and her impact on the HH staff was just amazing. We had some of our staff be there that day, and her enthusiasm for the work of Health and Human Services employees in the federal government was just infectious. I had employees who were kind of tired and burned out, and when they came back from seeing the First Lady, they have all kinds of ideas. They're sending me papers, they're sending me background. People who are really energized to be working with this administration and certainly having had the chance to meet the First Lady. And I just want to say hi again to my friends from home. It's always nice to see Kansans. And everybody's lived in Kansas. I want you to know I meet them all these days in my new job. Or they've driven through. So I wanted to start this afternoon by telling you about 2 conversations that I've had as a way to describe my work and by way of introduction. The first conversation took place in July of 2004. At that time, Kathleen Sebelius was the governor of the state of Kansas, and I was the assistant secretary at the Kansas Department of Aging. And the governor had me come over for a meeting, and so I went over, and she said, I would like to have you be the state long-term care ombudsman. At that point, I'd worked for the governor for about 10 years. I worked for her at the insurance department. I had found it helpful to take the job she offered me, and so I had, except for that day. When she asked me if I would be the state long-term care ombudsman, I didn't answer immediately. I didn't give her an answer. I said I need to think about it. And I thought about it for about 3 days, and I went in on a Friday to Joyce Allegrucci, her chief of staff, and I said, well, I've thought about it, and I've decided I'll do it. I'll be the state long-term care ombudsman, but there's something you need to know. I'm afraid of nursing homes. And in order to do this job, I will have to overcome my own fear to be able to go advocate for nursing home residents. That was in July of 2004. Well, 5 years later, this summer, on July the 29th, Secretary Sebelius, Secretary of HHS, swore me in as the 4th Assistant Secretary for Aging. And 2 days later, on July 1st, I met with my staff, and I had the new staff meeting that we've all had when you're new to a job. You bring your staff in, introduce yourself, talk about your goals, and then I gave them some advice. I said, all of us have bad days. I have bad days. And my solution when I have a bad day, and I've done this for a long time now, is to visit a nursing home. And when I visit a nursing home, I am reminded of why we do this work, because for me, it's all right there. And so I told my staff at AOA, the Administration on Aging, if you're having a bad day, if you don't remember why you're here, what we're doing, you have my permission to visit a nursing home, because you will find everything you need to know to keep on going. That's a 5-year change from July of 2004 to July of 2009. And so what happened in those 5 years to make such a difference, where I was afraid of nursing homes and then pleading people to go there? Well, one is I got over my fear, obviously. 2 is I had some great teachers at the Long-Term Care Ombudsman Program, at the Kansas Department on Aging. And I also had great teachers who are here with us today. I know in my mind who I consider to be the best nursing home administrators in Kansas. And if I were to make a mental list of the best nursing home administrators in Kansas, I will tell you that many of those individuals are here today. And I have visited most of their facilities. And they have also been my teachers. So I just want to say to those of you from home who've taken your time and greeted me and welcomed me in your facilities, that you've taught me much, and it's made me better both as the secretary in Kansas and certainly now as the secretary in Washington. My inspiration, however, comes from talking to the residents, because I have been to dozens of nursing homes all over Kansas, and I'm starting to travel around the country. I've talked to residents of nursing homes, I've visited senior centers, I've been to area agencies on aging, I've been to meal sites, I've been to adult day centers, and everybody tells me the same thing. And it's from talking to seniors and their families that I have developed the framework for my work. First, residents of nursing homes, regardless of age, are there for one reason. They lost their health. We must do everything we can collectively to help seniors stay healthy. Second, the seniors I talk to, both those in nursing homes and those other places, tell me the same thing. They tell me the same thing they tell you. We want to stay at home and age in place as long as possible. And finally, when nursing home residency is the best option, I sincerely believe that all residents deserve a quality of life as well as quality of care, and so we must continue to improve culture change and the culture of skilled nursing care. Those 3 things. Thank you. Those 3 things are my policy priorities: health, expanding community services for seniors, and culture change. I believe that covers the entire range of what we need to do collectively, and certainly as your partner in government, to help seniors age. So when we start with health, it's interesting to come to you today. I took an early flight, but I stayed up late last night watching C-SPAN, like other people did. Just so incredibly excited to watch the House pass a health reform bill that will help so many Americans. And I want to thank you all for your support. Thanks to your board, thanks to your leadership, thanks to all of you as members. I know that AAHSA was a supporter of the House bill, as were our colleagues at AARP and at the AMA. It's very, very important that we pass health reform to help everyone. And I certainly have been pleased to work for this president who's pushed so hard to change the healthcare delivery system and provide healthcare for everyone in this country. And I think we're closer than ever before, and we are closer to being able to provide sincere help for seniors to slow the rising cost, to help secure Medicare for those who are on Medicare now and those of us who hope to be on Medicare in the future. I know that Medicare is a sacred trust, and the President has pledged that he will keep that trust and keep Medicare strong. One of the various jobs I've had over the years is working directly with seniors who are struggling with prescription drug costs. And so I'm very excited to see the opportunity to close the donut hole, because I know how much seniors struggle when they hit the donut hole, and how many seniors, when they reach that time, start cutting the pills in half or stop taking their medicine, which may help them in the short term financially, but is very bad for their long-term health. So it's very exciting to see the donut hole closed. I'm also particularly excited that we can help with preventative care and encourage seniors to get their screening and wellness tests. Everything we can do to help seniors stay healthy, we should do. And as someone who administers programs for seniors, I've also paid particular attention to the issue with regard to hospital readmission. The fact that 1 in 5 seniors on Medicare goes home and is readmitted to the hospital, because what we know collectively is seniors often go home and their family members with them without sufficient support to help them stay at home. And those supports will involve interventions by both their doctors and the rest of us providing other types of support so we can help them successfully leave the hospital and stay at home. This kind of reform will be helpful to all seniors. One of the things that's been interesting since I started in this new job is to figure out what to call this next group, 50 to 64-year-olds. They're not quite seniors. I'm almost in that group. I don't think that we're older Americans. The baby boomers. This group of people have one of the highest uninsurance rates in the nation. And this group of people, 50 to 64, by this time has a health condition that will make it almost impossible for them to get health insurance. It's another reason why this particular group can be helped by health reform, because we know that when people do not have insurance, by the time they get to Medicare, they are more expensive, they're more sick. And so it's very, very good that we've also been able to move forward on health reform to expand the coverage to people who are not quite 65, because no one should have to wait to turn 65 in order to get adequate health care coverage. I also think access is important. Within the last year, I was invited to speak to the Breakfast Rotary. You all have been invited, I'm sure, to the Breakfast Rotary to speak about services to seniors. And so I did. I was in my hometown. I talked to them about the services we provided in Kansas. I talked to them about the issues facing seniors. And then I was finished and I left, and I had a woman follow me out of the room, down the hallway into my car. And she stopped me and she said, "Could you help me find a doctor?" And I didn't know what to tell her. I honestly didn't. I was just stumped. She said, "I've just moved to town and I can't get a doctor to see me." And this happened in Lawrence, Kansas, a typical college town in the Midwest. And we know this happens here in Chicago, and it happens in Seattle, and it happens in Washington. This is another reason why health reform is so important, so that we promote access to primary care so that seniors on Medicare can see the doctor. It's also important that we not cut the Medicare payments to doctors by 20%, because we know with a survey from the American Medical Association that if doctors get a 20% cut, they will see fewer patients, and individuals like the woman I met will never be able to find a primary care home. I know you've seen some video clips this morning about what you're doing to reach out and inform seniors about health insurance reform and health care. And I want to thank you for your efforts, for moving together with other partners in your Seniors to Senior campaign. It has been very disheartening for those of us who are committed to working with seniors and their family members to see the misinformation that's come out about the proposals. I certainly understand good policy debate. I've engaged in them for years. But we need to dispel myths and provide adequate and accurate information to seniors and their family members so they can make decisions about how they feel and how health reform may be able to help them. What I try to do when I talk to aging groups, aging providers, is recommend that people get good information by going to healthreform.gov, realitycheck.gov. AOA has sites. I'm sure AAHSA has information. AARP has good information. Featured this in one of their bulletins. But to help seniors to get information about what's happening in health reform, and not only now, but once health reform passes, it will be equally important at that time that we all are boots on the ground to help explain to seniors what the new opportunities are for them under health reform. So health was one of the things I realized that we need to focus on. The other was community-based services. I could spend a long, long time talking. I don't have that much time, but I could talk a long time about community-based services. I believe in them so strongly. And one of the things that I find myself talking about more and more, and certainly with this new job, is the importance of faith and family and community in helping seniors age. And I know from my brief experience in Kansas how many of you are affiliated with faith organizations. I think something like 70% of you are. I have seen Presbyterian Manor in Wichita and at Bethany Home in Lindsborg and at Village Shalom, and talked to residents about the importance of their faith as they age. From my own family experience, I know the importance of faith to help people age and to live the way for the rest of their lives that they want to and to be engaged. I think it's very important that we continue to be engaged with faith organizations. I'm looking for new opportunities to expand that engagement. I'm very proud that 2/3 of the area agencies on aging around the nation have good affiliations and coordination with faith organizations. I think it's critical. The other thing that, of course, is very important, and you'll hear more about this from the next speaker, are families and family caregivers. As I look at what we need to do in terms of program priorities at the Administration on Aging, I've called out two things, and one has specifically to do with caregivers. We simply need to do better to outreach to the 90% of people providing long-term care in this country, and that's family caregivers. It's very, very important that we provide support for the benefit of the person being cared for as well as the caregiver. Because I know the same things that you know in terms of what caregiving does, in terms of physical stress, emotional stress, and burnout, and how it can change the individual's lives and really have a detrimental effect on the caregiver. This is a family responsibility people want to take on, and I think our role as government is to find the people who need the supports and help them keep on going. Everything from respite care to helping adapt the home so that someone can stay at home. The other program idea that I've come up with, or certainly strongly feel, is that we must strengthen the core programs at the Administration on Aging. The program that everyone knows the most about is nutrition, because that's half of the money that we're spending. The core services that we administer through the Older Americans Act have not significantly increased for many, many years, yet we have more seniors who need services, and the services that we provide are targeted to the most frail and vulnerable seniors in our country, and they're usually poor in rural areas and more sick. We need to strengthen those core programs, increase our funding for nutrition and transportation and personal care attendants to help seniors stay at home and be healthy. There are so many things that we're working on at the Administration on Aging that you're working on with AAHSA. We have so many common goals and so many parallel tracks and opportunities to work together. And the opportunity to help seniors age at home is in the center. It's paramount, because we know that more and more seniors are needing help, that we have more seniors coming, and we need an opportunity to help them stay at home. And long-term care financing has been a struggle, because Medicare doesn't pay except for the skilled nursing rehab that many of you are providing. Medicaid pays for more than half the care, and certainly the states and the federal government are struggling with the cost of Medicaid. People are spending all of their money and becoming impoverished when they need skilled nursing care. And private long-term care insurance is only a small piece of the puzzle. I know that AAHSA has been working for a very long time on how to look at long-term care financing reform. That you commissioned a study. I got a copy of the study when I was in Kansas. I want to prove that I've read it, because I got about halfway through your study and thought, I think an actuary wrote this study. So I'm familiar that you've done a study, and you did a series of long-term care financing forums around the United States. And it's just amazing to me that it was as recent as March of this year that I was on a panel with you in Lawrence talking about long-term care financing. I know you're just thrilled beyond belief that the Class Act has been included into health reform, and I want to applaud you for your foresight and your knowledge that the future will require some assistance for seniors in a way they don't have now, and your very hard work on the Class Act has come to fruition, and we've got one more house to go. I know that the President is supportive, the Secretary is supportive, and I want to thank you for what you're doing to be able to provide a benefit to people as they age so that they have the choice of how they want to get their services and where they can receive them. So I want to congratulate you all for the Class Act and your hard work. Good job, folks. I could talk the rest of the day and then someone would come get a hook. Housing. I met with Larry fairly early after starting as Assistant Secretary to talk about the tremendous opportunity to talk jointly about housing supports for seniors. Having adequate housing for seniors as they age is the key. They need housing and they need services, and we must work together on both. We are working at HHS right now in a collaboration with Housing and Urban Development to talk about how we can merge our systems so that as we have supporting housing for seniors of low income, we can bring the services to them and that we can knit these systems together. I know housing is a major concern of yours, and tell you that the list will be very long of opportunities for us to work together on housing. We've also, at the administration, begun a wonderful partnership with the Veterans Administration. We're hearing from more and more vets as they come home from these two wars that they want community-based services. And we have a ready and willing network of area agencies who can provide these services. So we have more to do with regard to serving veterans. I know you have been serving veterans. I've met them in your facilities, and I want to at least acknowledge that Veterans Day is coming, and they've done a great service for all of us, and we need to continue to provide support. We can work on workforce. We can work on workforce because I know you have looked specifically at workforce issues with your Better Jobs, Better Care campaign, looking at how we can have an adequate and skilled workforce. The third issue that I had named was culture change, and let me talk about culture change briefly before I close. I think I'm the first Assistant Secretary that's really decided I need to talk about this in a big way. I simply believe so much in resident-centered care, deeply embedded resident-centered care, that I'm looking for the opportunity to talk about it now. You all have led that effort. I first learned about resident-centered care from CAHSA, Kansas Association of Homes and Services for the Aging, and these wonderful administrators are doing culture change. That's why I've met them. I've been to their facilities. We have wonderful opportunities on the national level to continue to talk about person-centered and resident-centered care. I think there are three ways that I can help. One is I can strengthen the work of the Ombudsman program in helping talk about and work with facilities on culture change. I can work with our partners at CMS and share with them my experience from the state level. And I can help talk to consumers because consumers need to know where to shop and what to buy, and that there's a different product that they have available to them, and they need to know more about it. So I can talk to seniors. I started by talking about my misgivings about even doing this work when I was offered the opportunity to be the state ombudsman. And I wanted to close by sharing with you my favorite quote from Eleanor Roosevelt, because this is the quote that gets me through those kinds of situations. You must do the thing you think you cannot do. You must do the thing you think you cannot do. We must pass health reform. We must expand home and community-based services. And we must change the culture of skilled nursing care. And if we do those things, all of us together sincerely will be changing millions and millions of lives, which is the purpose of your gathering today. Thank you all very much for your time.